you had some changes as a result of doing the OSB treatment, or therapy. So how about telling me what you were doing there? You know, that sounded very interesting, because OSB is about swallowing, speaking, and breathing. And so you were working on some speech issues, and what happened?
Well, we've been working on the same certain sounds, and they couldn't form the sounds.
How old were they then when you were doing it?
We've started since they were 3.5, 4.
Yeah.
So we've worked on it, now they're 8.
And whoa, that's quite a few years.
Yes. They've made gains, but there were certain sounds that they couldn't form on their mouth.
Right.
And once they got the OSB, even just the trainer, within a couple weeks they could make the sounds that they couldn't make.
Oh, that's cool.
And now they have those sounds consistently.
The actual appliances, and they're now, what do they call the appliances?
Oh, grinders. Because they grind.
And do you have trouble with the kids taking them out?
No.
Yeah, and
they don't even know they have it in.
Yeah, right.
Half the time they have to feel when we're going to eat, and they'll say, "Do I have my grinder in?"
Yeah.
They're so comfortable in them.
How far away do you how far is your home from here, roughly?
I think it's about 40 minutes.
Yeah.
Sometimes a little longer because of traffic.
Right. Well, it impressed me. So the day that we put the appliances in, the first night, one of the boys slept through the night, which was a pretty big thing.
Huge.
Yeah, and the other one had a sore spot, so his didn't stay in, and he had a rough night. And you came in the next morning.
Yes, it was worth it, because you gave him a different one, I think, because he had clenched it so hard, I think he flared it in the back. But when you gave him the new one, it fit perfectly, and now their sleep is so much better.
And what was it like before for you, without the grinders?
For sleep? Or
sleep. Like a night for you.
Well, I would listen to them, because a lot of times you couldn't tell they were breathing, and you wondered if they were, and I think there were times when they weren't, and then they'd wake up either gagging or coughing, and they don't do that anymore at all.
Yeah.
They used to have a chronic cough that they did it all day long.
I remember when they first came in, I forgot that. Yeah, it was almost a distraction.
Yes, and they don't do it at all anymore.
Yeah.
Like, they never do it.
Yeah.
So
I had forgotten about, one of them was really obvious. He was just always making a kind of a very, I mean, in public that would have been a distraction, I'm sure, to people around.
Yeah.
So then, why is it a daytime problem as well? What would make you think that this isn't just something you do at night?
I think that their cognitive abilities during the day have improved tremendously, because they have the ability to breathe when they're doing their therapies, schoolwork, all of the things that, was a struggle before, like even just to sit up straight. They were always
I noticed they would slip right out of the chair. And always had to have a Game Boy. Has that lessened any? Or is that about the same?
A lot of things have normalized. Like a normal amount of things, and then they go and do something else.
All right, so they're not having to stay affixed to something, that they can switch things and change their focus. Yeah.
Everything has been affected. Their play has been affected.
Tell me about some of the things that you were telling me about the play. Bike and swimming were two things.
Oh, right. Basically, within 2 weeks, I think it was in the first week, maybe week and a half, that they got the hard appliance. They both rode their bikes without training wheels. Their reading has improved. Their swimming, they were swimming with little noodles, and now they just got rid of them, and they're like, "Watch me," and then they'd swim across the whole pool.
As you were mentioning that, I was thinking, suppose that you had a noose around your neck and you're in water, which is all about breathing. You know, you're on a noodle too. But that gave them that freedom to feel like that they had a lot of control over their breathing. I'm sure that was a big deal. Ever noticed that, you know, one or both have kind of left theirs out and things are kind of, something's happening? I mean, it may not be, but have you ever noticed any symptoms creeping back in that you go, I know you don't have your appliance, and you go put it in?
Right. Well, the cough doesn't come back, which I thought it would, but the longer they've worn the appliance, it doesn't come back when they leave it out, even if it's left out a little bit longer. But they do tend to get hyper.
Yeah.
Like their play will change and get more frantic when they don't have it out, which makes sense because they're probably not breathing. Right,
and the adrenaline comes up to try to compensate for that.
So their play will change, and then I'll think, what's going on? And I'll see that they would have taken it out. We have a little spot on the counter that they take it out and put it in when they eat.
Very good.
So if I check that and they're in there, then usually I'll say, you know, you guys got to put your grinders in. There's so many things that kids with autism are struggling with.
Yeah.
And I would just beg any mom to try it. If they even think there's one thing going on with their sleep, if they have a hard time falling asleep, or if they notice they cough in their sleep, anything, I would just encourage them to try it because it'll help everything. Their speech, their vision, their tone, muscle tone, it'll help their cognitive abilities in school, everything. I mean,
it'll help their parents a little bit too.
It does, because you get rest knowing they're resting well. You don't have to, but it's helped them socially. I mean, it's just amazing. All these therapies that we haven't seen a lot of progress with, all of a sudden, amazing progress.
So you kind of call it, like we did earlier, performance enhancer. It's not that there isn't other things that could be done, but foundationally, if this is not done, everything else gets a little harder.
Right.
Yeah.
And it's so simple. All these other therapies are so hard, and they require so much energy from the parents and the child. And parents will willingly do that, but for something so simple to make such a huge change, it's so worth trying.
This hasn't been easy for you, has it?
No. Well, the OSB has been easy.
No, but I mean the journey that you've been on with this is not. I mean, it sounds like it's a challenge to do the jump through all these hoops.
But it's been amazing, to see them come so far and be doing so well.
And
you make my heart smile. It's been a long, long while. Oh, I feel such sweet relief. I got a hopeful life ahead of me. I rise with the morning light. I breathe easy all day and night. This state I'm living in's much brighter than before. And my heart smiles. It's been a long, long while. Oh, I feel such sweet relief. I got a hopeful life ahead of me. There's been a change, yes, I believe. There's no more pain, I'm feeling free. It's not like it's always been. No, I live for so much more. And my heart smiles. It's been a long, long while. Oh, I feel such sweet relief. I got a